Now, we have, obviously, we're in Philanthropy in New York, so we have a room with lots of funders, health funders in particular. So what would you, and also it's being taped, so there'll be those who weren't able to attend will be watching it
Amazing.
online. So what kind of a message would you want them to walk away from? Like, what would you want them to be thinking about after listening to you talk and then going and seeing the film?
From a sort of like funding and social change perspective,
Yeah.
like how do we? So I would say a few things. I think one, any aspect of the public health system and research system and system of care that's meant to um, prevent and treat and enable people who are disabled live good lives. Like we have access to zero. So it doesn't matter where you work. I bet your work intersects somewhere in this. I think there are a number of issues. It's I guess to understand that most patients aren't diagnosed. About 80% are not diagnosed. And that your access to diagnosis and care is very much determined by money, by class and access. I would also sort of say that whether it's the fact that we have a very hard time getting access to home caregivers, or the fact that there is very little private or public funding for research. We definitely need more investment in private research funding so that we can draw new scientists in and allow them to do the kind of preliminary work that allows them to be more successful when they apply to grants from the NIH, um, and uh, um, and that we also really need to think about medical education and how to get the word out about this disease so that patients can get access to that early care. Because even though I will never be able to prove this, the first year that I was sick, I was someone who, if I overexerted myself, it was because, it looked like this. It looked like that 12-mile bike ride I always did. I could only go 6 miles. Or like going skiing at Black Diamond with my family for a weekend long trip and only being able to ski the first day and then being in bed the second day. I didn't know what was happening to me, but when I was pushing myself to my athletic limits, I was crashing. And I kept doing that over and over again because every time I went to the doctor, they told me that nothing was wrong. And so there's this window during which it's possible that with intervention or at least management, I never would have become as disabled as I was. So even though treatments aren't available, I think there's a lot we can be doing on the prevention side if we have that education. So, and all of us has to come, I think, really be led by private support because there's just we're so early. I mean, the way to think about this is sort of any disease that we at least recognize and treat today, we're basically in, I don't know, 1900, 1920, something around there. And so, and my life chances today, if I were diagnosed today versus 5 years ago versus 50 years ago, are identical.
Now, is there, as you were going through this, was there any kind of like, because you touched upon home care, I know that also there's been issues as far as being able to provide that. Now, is that something that also, um, that was something that you also relied on, or was it really just you and Omar? And
Omar was my home care.
Omar was your home care.
And still is my home care. I, we've kind of just made it work. I don't, frankly, I'm not sure what access I could have had otherwise. I mean, I didn't have any doctors in my state really that could treat me, and I didn't. Every time I tried to access the system, people would be like, I mean, in some ways, it's like you say you have chronic fatigue syndrome, and no one believes it can get this serious. So, I would call and try to access different types of services, and I would get laughed at, like, you sound so young. Like, why do you need care? And so I think there's definitely work that we can be doing at the state level just to help figure out how to better advertise about what services people could be have access to, and how to just train people whose job it is to try to get people to those services sort of in this condition so they understand kind of what it is and the types of array of things people need. But the home care issue is really massive. I think there's better support in other countries, frankly, and here I know of very few people who have home care that's not their family, that they're not paying for privately.
Now, speaking of Omar, I just had to bring this up, and I mentioned it to one of your producers. Actually, Omar and I go back way back. We go back, and this is where I'm bringing him in. When I was at the Rockefeller Foundation, I was working on the Next Generation Leaders Fellowship, and I was actually one of the reviewers. And it turned out, I did not know that when I first met Omar, 2 years ago? 3 years ago. Until I saw the clip in the film, when your hair was much longer and wasn't gray. And then it all just came to me, and I couldn't believe what a small world situation it was, because quite honestly, I was in awe, and this is not, I didn't say this before, I was pretty much in awe of you and everything you had accomplished. And it was like, for me, it was like a no-brainer that you were going to get the fellowship. So anyway, I just wanted to share that small world personal moment on this. So really, for me, that's another reason why this became much more of a personal story as well. But I think also one of the things, there might be a couple of questions I'm not sure if anybody in the audience might want to ask while we have Jen and Omar up here.
And I'd also love to learn more about what you guys do and what your work is and how it intersects.
Sure. I just had a question about access. Oh, sorry. Rachel Pardo, Program Officer from the New York Community Trust. And I was curious about what you were talking about with access. Do insurers recognize the disease as it is now? And just kind of curious, for those that can seek treatment, are they getting private care? Are they able to get publicly funded medical care?
I had the exact same question. My add-on to that was, do they view the drugs you're taking now as experimental, and is there any coverage at all, or do they disallow coverage?
Yeah, so I think it is experimental. I think that, which is why we need trials so that more people can have access. I love being here in part because I think everyone, I go to a lot of screenings where people give me personal medical advice, but then also sort of, are so excited that I got better. And in some ways it's like, well, that's not the point. Like, Omar's a professor at Princeton. We have probably whatever is the top shelf version of whatever Aetna plan we have, and everything is paid for. And the drugs that I am taking would probably cost how much for, like, I know people are paying out of pocket, like 30.
I don't know for all of them. I just know I went in the first time she got this prescription for a drug, and like there was like commotion in the back of the pharmacy, and they came forward and they said, "Are you sure you want this?" And I'm like, "That's what the prescription says." And they said, "We're getting commotion." And like, "Well, that'll be $5,000, for this monthly supply." And I was like, "Let me check to make sure that the paperwork has been properly said." And it turned out it was covered, and and then it was a $25 copay. But like we're.
Wow.
But I do know, I know one person, I know a couple of people who are paying that $5,000 a month. I think, and so my doctors personally, I think, essentially, get creative with the coding, and there's sort of, and if you have certain tests that, like, in some ways the way that they often do it is they can measure certain, sometimes they can measure active virus. These are all antivirals to herpes viruses that were developed out of HIV research. And so you don't say you have this diagnosis, you say, this thing was observed, basically, and you code it a little bit differently, and that's kind of how you do it a lot of the time. But I think it depends just a lot on the kind of insurance you have access to. And if you don't have amazing private insurance, then no, you're not getting any care.
But the other part of it that's, I think, really important is that we are the patient 1%. We've been able to shop doctors all over the country to find people who each has their own protocol, and we've been able to find stuff that works for Jen. But most people don't have that kind of, I have months off in the summer. I have flexibility to go to doctors with her. Most people don't have that. A lot of people don't have the social capital to even know to negotiate with doctors. So it's not just that there are interventions. It's like you've got to do a lot of work even to get to the doctor who might be helpful.
And the other thing I would say is that there's this sort of, I could count on 1 to 2 hands the number of experts. So like everybody's served by a primary care doctor, and a lot of people I interviewed were like, I was diagnosed, and my doctor said, essentially go home and wait until someone knows something. And so most people just don't go see doctors. Like they and that's part of why the medical system doesn't see them, because people stop trying to access the medical system. And so, but those doctors are in like Fort Lauderdale, New York, and the Bay Area, and that's basically it. So there's so many people who, and you can't establish care usually until you go in person. So there's so many people who are like bedridden in, in Minnesota or in Iowa or in South Carolina. I'm thinking like specific examples, people I know, and they could never hope to even have access to the doctor who would prescribe because they can't go a block down the road, let alone get on an airplane and fly across the country. So,
but obviously the solution is doctors being better trained and being able to distribute.
Yeah, and clinical trials for the drugs.
In the film, you touched on gender issues. I'm curious to know if men showing the same symptoms are treated more seriously on average with this condition, and other issues that you've experienced on a gender relationship to this.
Yeah, so I think based on sort of patients I've talked to, I would say that I do think it's somewhat less likely that a man's symptoms are going to be psychologized, but it does happen still. But often I hear that story. I hear the story of they didn't believe me or told me it was in my head, or that I was just really anxious almost 100% of the time for women. And then for men, I would say it happens, but it's less common. This is a great survey someone should do. I would like to know the answer to that question. And so, but I, it's painful and it can be traumatic to be dismissed in this way. But then at the end of the day, I think for men, we're in the same boat. I mean, there's still not that access. So maybe you get diagnosed a little earlier, maybe you are believed. But I think men face this sort of challenge of like, just kind of like, I don't know, like buck up and be strong, especially men who are functioning fairly well. And there's all of these like gender expectations about opening the door and like lifting things, like really small things where people, if I communicate to someone that I can't do something, they give me the benefit of the doubt. But for a guy, it's like, are you lazy? Are you just like really unchivalrous? Like, what is it? And I've had that experience with patients sometimes where they treat us differently in that way. So I think gender plays a role in people's experience for sure. And I wouldn't say that it's better or worse, it's just different.
Hi, I'm Nupur Chowdhury. I'm also a program officer at New York State Health Foundation. Brian is my office mate, and he's been raving about this movie for months now. So we've got a crew here from the foundation. We're so excited to meet you. Yeah. So thank you so much for taking the time out to spend time with us. This is truly a gift. So the work that I do at the foundation is that I co-lead an initiative called Building Healthy Communities, which looks at place-based initiatives. But one of the pieces that we also notice is very much the issue of networks and cohesion around that. And you highlighted kind of how technology played a role in developing these networks. And so I'm curious, one, have there been any outcomes from the day of protest that you guys highlighted? And then also, have you been noticing any regional networks or regional kind of coalitions as a result of kind of connecting folks in the ether of the internet?
Yeah, that's a great question. So, and this predates my getting sick, but I think since there used to be like phone trees and letters, but really since there were listservs, patients have been connecting with each other using the internet. And I think newer kind of social media platforms have made it that much easier and that much have made these communities even more vibrant. And so many of people who are homebound or bedridden, their entire existence in reality really is online, and it's the friends that they make and the connections that they build. And so a part of the reason why the film is international is because our community is international. The community that I am in is really dominated by like people who converse in the English language, but that's people in the UK and Canada and in Scandinavia. And so you develop friends and you learn about what life is like for them there. I think what was really powerful about the protests is that for a lot of people, even though they'd been communicating online for such a long time, for many of them arriving in those cities and those places, it was the first time they'd ever met another patient in person in their lives. And so one of the things that has kind of come out of that is I think people have formed much deeper relationships, and we've created these spaces where what used to be more kind of like anonymous forum relationships have become real life friendships. And that has, I think, led to a much deeper kind of foundation for mutual support and also for activism. And so we're definitely building on, part of our film distribution strategy is really trying to go back to those cities where we had some of those events. And we're definitely also trying to build infrastructure here in New York and use our kind of the 7x6 is 42 screenings we're having this week. Tell your friends that to kind of do that kind of ground organizing in a way, and then try to use that to connect people to each other here in New York. We have an amazing woman named Terry Wilder who has been a kind of HIV educator and activist for over a decade, who was recently diagnosed with this condition, has been using all of her kind of tools and perspectives from that community and kind of bringing them here. And so she's been doing a lot of organizing and engaging with kind of health policy officials. And so we really are trying to kind of build a base of support here. And in terms of like, what can we do in New York State or New York City? I would love to continue that conversation, and she has loads of ideas of like simple things that we can do to make progress and reach more patients here in New York. Oh yeah, sure.
One other sort of somewhat place-based initiative, we have a donor who underwrote, why don't you finish the story?
Oh yes.
I was about to do.
You about to do that too? Thank you. So yes, we have a donor who on Monday was like, Jen, I think we should just let every doctor and scientist and healthcare professional just come for free to the film, and it was an incredibly generous offer. And now suddenly we're like, okay, how do we find all of these people to come to the film? So anybody who's working in health, like broadly conceived, we really want to get more people to see the film this weekend, and we're going to have 3 screenings. And if you have colleagues or friends, they are our guests. And we can definitely send around information about how to access that.
In other words, free.
Yes, for free. For free. Free tickets, because we really want you to come and we value the work that you do.
Right, and we will be sending out the all that information so that it can be forwarded to your grantees and other funders and any colleagues who are working in the healthcare industry here in the city.
Now that you guys have a bit more understanding of just sort of the life circumstances, like if you were to give us advice, like what is the first thing you would do or push for to start to create momentum? Because all of these things are kind of interconnected. Lack of treatment is related to lack of research, is related to the lack of diagnosis and the medical training, and it feels like a nest of sort of chicken and egg catch-22 kind of circumstances. And I'm curious from your expertise, like where would you, and we need more of everything, like truly, like where would you begin?
Hi, and I'm also at the New York State Health Foundation, Ursula Stewart, and I also can really personally respect what you're doing because I have the immune illness sarcoidosis. So a lot of what you went through, I have gone through too. And so basically, I think one of the areas really where to start, number one, with the free filming, that's perfect, starting with the healthcare community. And the area of research is, the problem with research is that it's expensive and that there's so many phases in order to even to have a clinical trial accepted. And so where to start are basically those hospitals that really, teaching hospitals especially, that can afford to have research for the illness. And recently, I'd say about 2 years ago, NIH started having patients involved in the development of clinical trials, and actually I'm working with Mount Sinai and another organization, a crowdsourcing organization, on a clinical trial for sarcoidosis. So that's definitely an area where you would like to start.
That's incredible. And the amazing one I spoke about, Terry Wilder, is actually, she works at Mount Sinai, so I should connect you guys.
Is this working? Yeah. Just a quick question. Do you have a sort of short, punchy version of this? Because making a near 90-minute film available for free will still only reach a very minimal amount of people, and even if you posted it online, it's too long for it to go viral, so to speak. You've got such rich material, it's not easily made punchy, right? But figuring out if there is some short version that could get much wider distribution, be put on people's websites that's just trailer length, that would give you a massive way to distribute what you've created here in terms of a communication tool. So,
sorry.
No, I was just going to say also something that I can actually use as a learning tool in medical schools. Before resident or universities decide to determine where their specialty is going to be, so it actually becomes more of the fundamentals of practicing medicine before they go into specialties.
Yeah, no, so I think those are really, really good points. It's something we intend to do. It's always a question of capacity. For right now, we've been using kind of the first 20 minutes in situations where we want to do a short lecture and be able to sort of show you a little bit of the world and talk about it. But we interviewed so many clinicians and researchers and patients and have so much more information than even what's in the film. And so we definitely intend to edit video for web, edit video for educational curricula, and really try to figure out how to create the right length and format and content for different audiences and platforms. So it'll be a process. I think it'll kind of continue throughout the campaign we're launching tomorrow, through the next 12 to 18 months. But and we also definitely want to eventually release an educational DVD that would have the film, but then have lots of variable length and content stories and that people can then use in curricula in different ways.
Just add, if you haven't already, talked to Vince Staley at Media Impact Funders, who it's a national association of funders that funds documentaries and other media projects for social good, and he, I'm sure, would have a huge amount of advice on distribution and connecting with funders who would be helping get the word out using media. The organization is Media Impact Funders, and it's Vince Staley, Stehle.
And I think just to piggyback on your statement, also to somehow find some sort of champion in the psychiatric field, because that's part of my chronic fatigue story, is a neuropsych eval that's following me around. Where I have a post-traumatic stress disorder and a dependency disorder that continues to show up and mess with my disability and things like that. But I think also, if there's some sort of snappy thing I have chronic fatigue, and it's just a 5-minute thing that's collected on a website or collected where it's a bullet pointed thing of, I'm a mother, I'm a New York State senator, I'm a whatever, and I have chronic fatigue. And a snappy sentence, as you said, or a very quick way to communicate this that provides more understanding. And I don't know what that is, but it's very quick, and it's bulleted, and it's a lot of faces of people who are your next door neighbor and are your, and I think that would be helpful, and even to me, because when I say it at church, my friend will say, "Oh yeah, I'm so tired. I'm so tired too," and isn't getting old difficult.
We had Jen interviewed a 14-year-old boy who had this really profound insight, which was that part of what's so hard about the language is that everybody has a direct experience of fatigue, and so we all project all of us who are not ill with this, or something related sort of say, oh yeah, I have an experience of like getting a bad night's sleep. And so everybody thinks they understand, and at the same time, we don't have language for what is going on, which is something, potentially at the level of mitochondria not making energy that like means your tank is running at 5%. And so this is just sort of, some of the patients have said part of the power of the visual images is that it sort of gives them a vocabulary. They won't have to explain. They'll be able to say, watch this movie, and then you'll understand what it is I'm going through. And just one very last quick point is, I think I was a little bit skeptical of what kind of work a movie could do, and I think part of what's been very powerful for me as an academic is to see how much changing culture can change science and medicine.
I'll just add one more thing before we wrap, in which and thank you everyone for your time. I think the other thing that we want to also think about is I know of like the thousands of patients that Oh, okay. Is this okay? Sorry. I actually have a history of holding it too far away, and everyone's like, closer, closer. You can hear me okay. Sorry. I have, so of the thousands of patients that I now know in my online community, there is only one African-American woman who I know of. I know her well, but she's like the one. And through my TED Talk, we actually now have like a 3-person African American caucus as a part of the Emmy Action Network, my nonprofit, and I, the community-based studies that we've done sort of suggest that the prevalence of this disease is equal across all racial and ethnic groups in the U.S. I don't know if that's true. I think we need kind of broader studies. And I think what she would say is that a lot of people are getting diagnosed with fibromyalgia, but who have this kind of core symptom of post-exertional malaise, the sort of the metabolic kind of issue. And so I don't know if you or anyone here has ideas, but it's sort of, I have a little bit of like regret that in some ways the film is a bit an advertisement for the stereotype that this is like a white woman's disease, and at the same time, there was just no one that I could find who had been diagnosed that I could reach or access. So I think that there are a lot of communities where people who are living this experience and hurting and are just not getting diagnosed. And I'd love any ideas you might have about how to get the word out and how to engage and where to bring the film and maybe some of these shorter videos that would help to kind of explain that part of the experience. So just something to think about, and if you have feedback on that, we'd love your help.
Sure. Well, thank you very much. I know we're over time.
Yes, sorry.
No. But thank you for coming out. I know with the weather and everything like that, it's really been an honor and a pleasure. And this has just been wonderful. Thank you.
Thank you.